Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is what you need to know about facet injections. Well, what's a facet joint? These are the small thumbnail-sized joints on either side of the spine at every level, from the neck all the way down to the sacrum. These joints are small, but they have cartilage just like the hip or the knee, and in combination they allow for an incredible range of motion of our spine. So what makes a facet joint painful? They are prone to arthritis just like other cartilage-bearing joints. Even though they are small, they can cause a ton of pain. Typically, it leads to pain in the vicinity of the arthritic area. Often patients have several arthritic joints at the same time, so they can have a diffuse area of back pain. So here you can see, looking at it sort of from an angle, this is the back of the spine, this is the side. These are the nerve roots coming out. These are the cartilage facet joints. Okay, this one looks pretty good, this one looks pretty good. This one looks overgrown, kind of ratty with extra bone formation. And the red signifies inflammation around this area. Okay. So why are facet injections performed? Well, when you have symptomatic facet arthritis, surgery is not a good answer, because if you fuse that level, we don't have a good facet joint replacement, all right, then you fuse it, then it stops motion at that level, and the stresses start to go up or down. You can start to get adjacent segment degeneration. So it's best to try and treat it without surgery, all right? Now, similar to other joints with arthritis, facet joints respond well to steroid injections. It's an outpatient procedure. It only takes 10-20 minutes. Modern pain doctors will use imaging guidance such as fluoroscopy or ultrasound. Typically, you don't need IV sedation. You can just numb up the soft tissues down to the area. Needles placed into the joint. It's dye is typically placed to ensure accuracy, and then steroid and numbing medicine is placed. Several levels can be treated at the same time. Pain relief will last anywhere from weeks to months, and then it can be repeated. So what happens if the pain comes back? There are 3 treatment options if the pain comes back. 1 is to do another facet injection. 2 is to do a medial branch block, which is where the needle does not go into the joint. It goes around it in 2 areas, above and below, to numb up these little nerve endings that provide sensation, called the medial branches. So a medial branch block blocks those nerve endings, okay? And a third option is what you see here. It's called a radiofrequency ablation. A catheter is placed, heated up, and it deadens those nerve endings for anywhere from 12 to 18 months. A medial branch block itself can provide 3 months of pain on average, and then the RF provides a lot longer duration. Are there risks? There are very low risks with the facet injection. There's a very minor risk of infection, some bleeding, and allergic reaction to the medication. The needle does not go into the epidural space, so there's a negligible risk of any spinal cord or nerve root injury. The top non-operative pain management in the Mid-Atlantic area is through the Mid-Atlantic Pain Network. There are many clinics throughout the region accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.